In today's video, I'm going to cover advanced glucose monitors from a feasibility point of view. So how would providing public coverage or access to everybody living with type 1 diabetes impact our province's healthcare system financially, as well as some additional factors that's not so easy to put a value on. But before we get into it, let's just talk about the current status of public funding for these devices across Canada. In March 2020, the Yukon was the first province to announce public funding. Since then, there's been announcements in BC, Saskatchewan, Manitoba, Quebec, and PEI for varying levels of advanced glucose monitor public coverage. So what's the big difference between these two systems being the conventional method of finger pricking, where an average patient gets between 3 to 8 blood sugar readings per day? And then there's advanced glucose monitors, which encompasses two different types. There's the flash monitor, in which somebody or a user will tap the device off their phone to get a reading, and then you get an average of 15 to 20 readings per day. And then there's a continuous glucose monitor, which sends the reading every 5 minutes via Bluetooth, and that gives the user 288 readings per day. So from this perspective, I think of diabetes as a data-driven disease. The more data points you have, the earlier you can intervene and make management of your glucose easier. So to determine cost effectiveness, we're going to do a budget impact analysis to determine whether these devices are affordable. However, we're not just going to look at the upfront costs, we're also going to look at the potential cost savings by reducing complications, which is something that CADTH, or the Canadian Agency for Drugs and Technology in Health, did not do in their reports to date on advanced glucose monitors. So we need to compare the upfront cost of these devices with the complications with type 1 that are common but also directly preventable. So things like acute hospitalizations caused by severe low or high blood sugars, as well as the other complications that are associated with chronically elevated high blood sugars. So for the purpose of this video, I won't go into all the numbers and calculations I did to come up with this budget impact analysis. However, if you're interested in doing a deeper dive into it, check out the link to the presentation below and you can see how it was all calculated. But to summarize, after calculating all the costs for complications and taking a conservative midpoint, we get a direct preventable annual cost due to complications being at least $30 million annually. And then if we compare that with the upfront cost of advanced glucose monitors, assuming a 40 to 60% uptake rate, which would look like a $2 to $3 million annual investment, which would save $30 million annually as well, and would be between a 10 to 15 times return on the initial investment. And outside of cost savings, there's a ton of additional benefits, and I just want to touch on several of them. We'll see improved quality of life and treatment satisfaction, and there are many YouTube videos that do a deep dive on this. We'll see a significant reduction in emergency-related hospital visits, and therefore an increase in our healthcare system's capacity, which would have a beneficial impact on our paramedics and our emergency departments, as it would likely reduce their workload. We'll see a significant improvement in clinical outcomes, and the guidelines were recently updated to reflect this. And last but not least, advanced glucose monitors are the gateway technology for patients to be able to use hybrid closed-loop systems. A hybrid closed-loop system is when the insulin pump, the advanced glucose monitor, and an algorithm on your smartphone all speak to each other and automate your bolusing decisions for you. But without an advanced glucose monitor, you can't close this loop. Unfortunately, the current ability of a patient being able to manage their condition is highly dependent on luck in the case of private insurance, and then there are also some other social determinants of health. So things like socioeconomic status, or perhaps being part of a visible minority, among many other social determinants. And evidently, these barriers to good health outcomes are only costing our province more money. So to summarize, by providing public coverage for advanced glucose monitors here in Newfoundland and Labrador, to those who don't already have coverage through private insurance, we'll see at least a 10 times return on the investment. We'll free up some of our system's capacity as well as facilitating virtual care. And then we'll have all those intangible benefits for the 5,000 odd and likely a lot more individuals in the province who are living with and impacted by type 1 diabetes. Thank you for listening.